Hello, everyone. We're late on the briefing. We just did a thing on the personal income tax, and very regretfully, it's a dead item. Again, I thank the Senate for all that they've done, and 2/3 of the government, the Senate and the governorship and everything, all in, and the House won't even vote on it. So it's disappointing, but that's what we got to live with. Anyway, we've had 15 additional deaths in West Virginia. I hate that like crazy, and the trend still is good, but we've gotten 3 red counties now in the state, and we've just got to continue to be on guard. Or I'm just going to be able to sit here every day, of which I hate like crazy, to sit here and read names, not necessarily names, but the numbers and the people, the counties, their sex, their age of people that we've lost. And, if we don't get vaccinated and we don't continue to wear a mask and be cautious in every way, washing our hands and keeping our distance and everything, all you got to do is watch. All you got to do is watch what I'm going to have to do day after day after day, and that is sit here and read to you the people that we've lost. Great West Virginians, could be you, and absolutely with all in that, great people that these people's families and loved ones are hurting, and it's a shame, and I hate it. I hate it so badly. Our 2,723rd death is an 86-year-old female from Morgan County. Our 2,724th death is a 71-year-old male from Marshall County. Our 2,725th death is an 84-year-old male from Morgan County. Our 2,726th death is a 71-year-old female from Harrison County. Our 2,727th death is a 67-year-old female from Putnam County. Our 2,728th death is a 91-year-old male from Barber County. Our 2,729th death is a 62-year-old female from Ohio County. Our 2,730th death is a 76-year-old female from Putnam County. Our 2,731st death is a 49-year-old female from Berkeley County. Our 2,732nd death is an 83-year-old female from Grant County. Our 2,733rd death is an 81-year-old female from Harrison County. Our 2,734th death is an 82-year-old female from Putnam County. Our 2,735th death is an 81-year-old female from Pendleton County. Our 2,736th death is a 62-year-old male from Brooke County. And our 2,737th death in West Virginia is a 73-year-old female from Nicholas County. Just imagine. 2,737 great West Virginians we've lost. Please, please keep them in your prayers. Some way, somehow, they'll be able to feel your prayers and to feel that they're not alone. Please, please do that. We have 479 new cases in the last 24 hours and a positivity rate of 3.70. We have dropped to 5.23 in our cumulative rate. We have 7,084 active cases and 135,000 and change recovered. We have 280 patients now in our hospitals and 87 in the ICU units with 3 red counties, Boone, Raleigh, and Berkeley County. Again, I remind you, if you're 65 years of age, you cannot possibly sit there and hear me calling names day after day, and if you get a cold, a sniffle, a headache, tiredness, anxiety, go get a test. Just go get a test. If by chance you were positive, we catch it early enough, the antibodies will save your life, and absolutely, we think that in every way, and if you don't, you're in for a tough go. That's all there is to it. The other thing is we just found out that in Berkeley County, we now have a confirmed case of the South African variant. It is more and more and more testimony that now it's in 36 states across our nation, but now it is in West Virginia, and Dr. Marsh and Dr. Amjad will tell you more about this, but this is an extremely transmittable variant, and so it is really important to stand up, and absolutely super important to stand up about wearing your mask. The vaccine eligibility is all up there, 16 and above, and to young people today, I am again calling upon all West Virginians. Now you got to help me, West Virginia. I did this on Wednesday. But I'm calling on the parents and the grandparents to step up and tell your children, ages 16 to 35 years of age, we have got to get you vaccinated. We have got to get you vaccinated and get you vaccinated as quickly as possible. Not only could it save real sickness, maybe death, but young people can absolutely, with a life of decades and decades in front of them, they can be harmed possibly with side effects, heart or whatever it may be. We have got to get you vaccinated from the standpoint that you are the people that are transmitting this faster than anyone else. On a vaccine distribution update, yay, West Virginia, great job. We now have in the arms of West Virginians in excess of 1 million doses, 1,056,510 doses in the state of West Virginia, 645,000 first doses, 433,000 second doses, and that's a change and everything, and so that's great stuff. From the standpoint of saving our wisdom, we have now 65 years of age and older. We have now put in ours 254,000 doses, and in that there's 210,000 that are now fully vaccinated. We are over 75%. Unbelievable. Way to go. Way to go. We're on our way to 85. We absolutely set a goal in the beginning to try to get to 70 or 75. I said, no, we're going to fly by that and everything. We're going to absolutely keep going. We got to absolutely get to 85 plus. On the manufacturing stuff and everything, you know, we can go to businesses, we can go to churches, we can go to ball teams, we can go to schools, we can go to all, we are begging people to give us arms to put these shots in. It will save all kinds of lives and everything. And all we ask that you do is reach out to the numbers that you've seen and get in touch with us, and we'll schedule it all. And we'll come to your church, whether it's a church pastor that reaches out, we'll come to your business, we'll come to your school, we'll come to your ball team, whatever it may be, we'll come and try to take care of you as quickly as we possibly can. You know, the vaccine info line is all up, vaccine reminders. You know, you've got to take your vaccine. I keep telling people, for crying out loud, just please listen to me. The side effects are almost nothing. The absolute chance of you getting one of these variants, or absolutely getting this dreaded disease, and then having just, I mean, I don't know how to say it, but other than just hell to pay. That's all there is to it. If you happen to be especially an elderly person, and you get this, and you don't get the antibodies early enough, you're in real trouble. You're in real trouble. And life is going to be really, really bad. Really bad. So, as far as our free testing, it's available, it's easy, it's nothing to do. We thank Fruits, we thank Walgreens. As far as the outbreaks, we've got 8 long-term care facility outbreaks. We've got 7 outbreaks in our churches in 6 counties. Those counties are Fayette, Grant, Harrison, Kanawha, Nicholas, and Raleigh counties. We have 97 inmate cases now and 9 staff cases, 36 at the Southern Regional Jail, 34 at Salem Correctional Center, and 23 at South Central Regional. Guidelines, I tell you over and over and over, they're all up. Wear your face mask. Don't just absolutely start running with the bulls and forget your face mask. We're not through this, but we're close. I don't know how many times I've got to tell you, I can't stand these things, but these are lifesavers. If you believe the contrary, you're going right in the face and defying what our CDC, Center of Disease Control, what our government in every way, what President Trump told you over and over before he left office, absolutely what our super experts, our coronavirus czar, Dr. Marsh, everybody is telling us and advising me, you got to wear your mask. Please consider giving blood. And now I've got to report one thing that's really tough. We lost a firefighter. We lost another one of our brave first responders in the line of duty this week. On Easter Sunday, the Albright Volunteer Fire Department in Preston County responded to a wildland fire in Preston County. Albright Captain Charles Wesley Chuck Miller answered the call. Captain Miller was driving to the fire to assist when it is believed a possible medical emergency caused him to lose control of his vehicle. Captain Miller, 62 years of age, had been a firefighter with the Albright VFD for nearly 30 years. He is survived by his wife, Carrie, their 2 sons, a grandson, and other family members. Kathy and I send our deepest condolences to his family and loved ones of all those that are friends and family of the Albright family or the Albright community. Now, let me just say just this. We always take time to recognize those that we've lost. But this gentleman here gave so much, 30 years, protecting and looking after his community. A great community in the state of West Virginia. We can never thank him enough. We can never thank the family enough. And great goodness alive, I know he'll really be missed. So, God be with him and all this great family, please. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
That we are in a new part of this COVID-19 pandemic response in West Virginia and in our country. And as we look at our strategy, there's really 3 different parts of our strategy that are connected now. And the first part is, as we've done from the very beginning of our pandemic response, we focus on saving lives and reducing hospitalizations. And that means we target our over 65-year-old population, which accounts for a majority of the deaths that we see from COVID-19 infection, our over 50-year-old population, which is what accounts for the age grouping for 97% of our deaths, and our nursing home and long-term care facility, as well as assisted living population that accounted before our vaccines for about 50% of our deaths. So we continue to try to expand the number of vaccines, because as we hear the governor read the names of West Virginia who have died, it is in this group that we still see way too many deaths in the citizenry of our state. The second front that we are approaching strategically is our younger people. As we've said many times with these variant viruses, and now that we've found the South African variant in West Virginia, as well as we see growth of the United Kingdom variant in West Virginia, we recognize that these variants are more infectious, can spread easier, and we see the spread of infection mainly in our younger population. So as we work to really focus on helping younger people be protected from the impact of COVID-19, which has these new variants are perhaps more severe for even young people that are generally have been felt to be protected against these consequences of COVID-19, including being sick enough to be hospitalized. And also that we know that these folks spread the virus, and that accelerates the spread of virus in our state. So we're really focusing on trying to help these young people and their families choose to get vaccinated to protect themselves and to protect each other, as well as to protect the populace of West Virginia. And we know that particularly on sports teams and extracurricular events, that this virus is spreading more rapidly. So the benefits of getting immunization for the COVID-19 virus include the ability to continue to play sports, to stay healthy, to not have to quarantine. Today, if one person on a team gets sick, then everybody needs to sit out who's been connected with each other. But in a fully vaccinated population, that is no longer necessary. So I think for the safety of our children, and also for the ability to continue to reduce the spread of COVID-19 and these variants in West Virginia, it is really, really important that through our school systems and our Higher Education Policy Commission and with younger West Virginians that we see this population choose to be vaccinated, which really will help us buy more time, because the third focus is that we need to vaccinate all of our population. That we know that the older part of our population is dying more commonly from being infected with COVID-19. Our younger part of our population is spreading COVID-19 more quickly, but it is the rest of our population that is also at risk for developing long-term effects of COVID-19, being hospitalized or dying. And so the more people we can immunize, the better. The country of Israel has immunized about 2/3 of their population. And what they've seen today, they went from about 7,200 cases on average a week in January to now 300 or 350 or so cases per week that they've seen in this current week. But almost all of their deaths are in people that are not vaccinated or who are not fully vaccinated. And that means they're 2 weeks or less from that first dose of vaccine, because we know it takes at least 2 weeks to get the immune response. So learning from other countries really gives us insight for West Virginia, which says for all of the right reasons, for us to continue our leadership position, but more importantly, for us to continue to be able to save lives, reduce long-term impact of COVID-19, and to reduce the spread of new variants that offer much more problems, many more problems in the rapidity of spread and the severity of disease, then we all need to work together to make West Virginia the place that reaches its potential and continues to be the beacon for the rest of the country and even the rest of the world to see. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the DHHR.
Good afternoon, everyone. We've implemented some additional changes to the COVID-19 dashboard. We're now including statewide immunization information system data. This is to be more consistent and in line with CDC reporting. Doses administered will include doses that the state receives and doses administered to the federal pharmacy and the FQHC programs. We have not had direct access to that information in the past. Doses received will only include total doses received, including doses that have been received through the federal pharmacy and the FQHC program. We can't separate the federal pharmacy and the federal FQHC allocations by first and second doses. So please understand we're using the best data we can to be fully transparent with you. Partially vaccinated will change to people receiving at least one dose in alignment with the CDC measure. This will include the total number of people who received at least one dose of the Pfizer or Moderna COVID-19 vaccine, and the total number of people who received a single dose of the Johnson & Johnson's COVID-19 vaccine. Fully vaccinated will stay the same, and the data that is included in the metric will not change. This is also in alignment with CDC measures. Johnson & Johnson doses administered will be counted in both people receiving at least one dose and people fully vaccinated. There's actually a yellow tab that will now on the vaccine summary tab that will give you additional information and definitions for those. So again, those changes are to try to continue to be transparent and provide as much information as we can to the public. Thank you.
Thank you, Secretary. Dr. Ayn Amjad, our State Health Officer, and retired Major General Jim Hoyer, Director of the Joint Interagency Task Force, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Mark Cram with WDVM.
All right. Good afternoon, Governor. Good afternoon to everyone. We appreciate your time as always. It's now been about 10 days since the electronic death reporting system was implemented. I'm wondering how that's working. Are you satisfied that it's working as envisioned? And with the new variant showing up in Berkeley County, can we be assured that the current vaccines, all three of them actually, are effective against it? Thank you.
Okay, Dr. Amjad, maybe you can take this. Mark, I do not think that it's completely up and going and been implemented yet, but I could be wrong.
Sure, Mark. So the governor's right. We are still looking into different vendors and looking into that. It does take some time, the electronic death reporting system, but we are aggressively looking into that to implement something rather quickly, but it does take some time. And to answer your second question, and Clay might want to add to it, the vaccines that we do have right now are, they do work against the UK variant and the California variant. As far as the South African variant, I do believe it is effective if you have the 2 doses of the Pfizer one. But the Moderna and the J&J, I'm not sure if there's any new data out there, Clay. I do know the Pfizer vaccine is for the South African variant.
Yes, thank you, Ayn. And just to add on to what Dr. Amjad said, that all 3 vaccines, when used in real-world circumstance, have demonstrated effectiveness in protecting people from hospitalization and death. We do know, however, that in a laboratory setting, because of a particular mutation in the South African variant, that native antibody production, so people that have just recovered from COVID-19 with no vaccination, may not have as good a protection longer term. And so that's the reason why we recommend everybody, even if you've had COVID-19, to get vaccinated afterwards so that you will have that protection. And in addition, the vaccine manufacturing companies are continuing to anticipate that these viruses will continue to mutate and to continue to have more ability to infect easier and perhaps have more lethality for people. So they are constantly upgrading their vaccines as well, which is a benefit of these messenger RNA vaccines that are produced by Pfizer and Moderna, so that if a new mutant comes that is more resistant, that we can revaccinate people potentially against that variant as part of our strategies.
All right, thank you, Mark. Next to Katie Coyne with the Charleston Gazette-Mail.
Thanks for taking this. Governor, you're talking about how we have in excess of over 1 million doses given. There are still counties that have not vaccinated a single Black person. In some counties, the rates of vaccinations among the Black population isn't even comparable to the vaccination rates among the white population. We're months into this. How are we dealing with this now, and where do we change gears here to make sure that we are getting more minorities vaccinated?
Well, if I could start, if that be the case, I have no knowledge whatsoever, and I would really question that as being credible information. But General Hoyer, maybe you could answer that, please.
Yes, Governor. Katie, as you have heard before, DHHR has a very significant outreach with the African American community and other minority groups. And we are working aggressively with a variety of groups to continue to address access to vaccines, but primarily vaccine hesitancy initiatives. You do have some small counties that have very small minority populations that we continue to work with local health departments. So I would categorize, from my perspective, that West Virginia is doing an aggressive outreach to address populations, all populations, and we will continue to work hard to make sure that we address the challenges that we and other states across the country have with getting to minority populations.
All right, thank you, Katie. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I was wondering if now that we're starting to see more of these variant cases pop up and we now have, multiple variants in the state, is there any plans to add some way of tracking those and keeping track of it to the DHHR dashboard? Thank you.
I think maybe Bill Crouch could answer this, please.
Yes, sir, Governor. Thank you. Charles, that's an interesting point. We have not contemplated really tracking that on the dashboard. We do keep that information and follow that information, and our epidemiologists, especially our state epidemiologists, tracks those cases. We're doing more and more sequencing so that we make sure we identify as many of those individuals as we can. But it's a good suggestion, something we need to take a look at, and I'll make sure we push that forward and see if that's possible. Thank you.
All right, thanks, Charles. Next to Kenny Bass with WCHS and Fox 11.
I have a question for General Hoyer, going back to distribution of vaccines. General, I know there was a lot of talk several weeks ago about homebound patients and getting the vaccine to probably one of the most difficult populations because you have to deliver it rather than them coming to you. What progress have you guys made on a plan? Has it already been implemented? Are you moving forward? And does it by chance include the Johnson & Johnson vaccine, which would make it more convenient because you only, of course, have to make one trip to your destinations? Thank you.
General, please go.
Yes, sir, Governor. Yeah, Kenny, there are several initiatives going on, as we mentioned in an earlier press conference, working with senior services to identify homebound population that are served. As we also mentioned, those family members or neighbors that know of homebound individuals that have not been served yet, if they will please reach out to our hotline and give us that information. That goes to our interagency task force that then coordinates directly with local health departments to identify whether it's a pharmacist or one of the mobile capabilities that we now have stood up with the National Guard or some other method to get to folks. So I think we are making good progress. We'll continue to find people clearly on a regular basis that will need the assistance that we'll get to. As it relates to Johnson & Johnson, Clay and I and our medical team have in fact helped us focus where like homebound and other populations where getting that one shot is much more logistically sound and probably more sound for those individuals. We are using those Johnson & Johnson doses.
All right, thank you, Kenny. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Last year, about this time, you were announcing the comeback plan, and then in the middle of the summer, we started getting reports that there had been a lot of cases emanating from Myrtle Beach, South Carolina. Knowing that as a history with this virus and given the variants that are out there now, what is the situation? Would there be a repeat of that situation possible with the variants and Myrtle Beach? And do you plan to do anything proactively to advise West Virginians to stay away from Myrtle Beach if it is going to be bad?
Paul, it's hard to believe, isn't it, really? It just seems like it was yesterday. I hadn't thought in any way about Myrtle Beach, but it's summer again almost, isn't it? And it's been it's been a long road for a lot of folks. And it's been a tragic road for a lot of folks. You know, at that time, I mean, there was forecasts from people out of Washington State and so on that we were going to lose 64 people in the state of West Virginia, and I was saying there's no way. There's no way. You know, and that may have not been exactly at that time. You know, it may have been earlier than that, but we've lost 2,737 people in West Virginia, and all I can say is, Paul, we're going to continue to stay abreast of everything that's going on all across this country and absolutely listen to every expert. And right now, I don't really have any warnings for Myrtle Beach, but boy, what an incredible question, because gosh, you know, it's like, boy, did that ever hit home. I mean, because gosh, it's summer again. It's been a long time. Anyway, thank you.
Thanks, Paul. Next to Junaid Dill with the AP.
Hi, Governor. I think this is mostly a question for the health experts, just because it's about the dashboard. It says on the dashboard that about 69% of senior citizens have received at least one dose. Is that accurate, or am I reading something wrong here? Is that number not 79%? And as for the percentage of total doses administered, it says 86.9%. Does that include doses for pharmacies in the federal program as well? There's been some talk of in other states, the pharmacies going slower in terms of administering the doses. So I was curious. Thanks.
Thanks. And I think people are going to have to answer this question, because my update here says we've got 75% of those 65 and above with one shot, but maybe, Secretary Krause, you can answer the questions about the dashboard stuff.
Yes, sir, Governor. Thank you. Yes, that is accurate information. Again, we're including information from the federally programs, the federal pharmacy programs and the FQHC programs. We're actually ahead of the country if you look at the totals. West Virginia has 36% of total doses administered, and the United States has 33.7%. So some of these numbers have changed. If you look again at the yellow tab, it will give you that information and give you some more definitions there that will assist you. But I think the second part of your question, trying to think what that was. Sorry, you had the question about the 69%. What was the other part of your question? I'm sorry. Does that include
I'm wondering if it's accurate that 69% of people age 65 or over have gotten at least one dose, or if that number is higher, as the governor says.
We'll have to look at that. I think the governor is accurate, and Jim may have that information in terms of the federally funded. General Hoyer, you have that information?
Yes, sir, Bill. So, Junaid, going back to your first point, the 75% that we reflect with the governor also includes the VA, and there are a couple other federal entities that are not fully reporting into the CDC data. As I mentioned last week, Tim DeBar from DHHR, 2 personnel from WVU, and our GIATA staff and Joe Peel are working with CDC. We've had great cooperation with them this week. And as to your point on the 89% number, remember too that we're calculating in their first and second doses, and second doses tend to come at the end of a week as far as those clinics of those numbers. So that's where you see that impact as well.
All right, thank you, Junaid. Governor, I'll turn it back to you.
Okay, well, thank you, everybody, especially thank our media and everything for being on with, for the PIT and the COVID briefing. And And again, please keep all these folks in your prayers. They're going through a tough time right now. You know, the 15 we lost, you know, since Wednesday, and plus all these folks that we've lost all across our state. The other thing I would promise you, or will promise you, is just this: we'll work harder at getting to those that are homebound. We've got to have the cooperation and help of the neighbors or relatives or anybody that knows of a homebound person and everything. If you'll call our hotlines and everything, we'll get there. Just help us just a little bit there, and I promise you we'll put more emphasis on that. And so I just won't have to repeat myself to the players that are on the, you know, all the experts that are on with me now. Hear me out. Let's double down and make an additional extra effort for all the homebound. I know we're doing that, but let's really bear down and get after that and try to do just a little bit better if we possibly can. But anyway, thanks to everybody, and anyway, we'll just keep at it and everything. Please wear your mask. These variants and stuff really scare me, but at the same time, we're going to get rid of these masks if we'll just go get vaccinated. That's the biggest thing we got to do right now. We talked about bridging ourselves to the vaccine. We got our vaccine and we got the supplies. Now we need you. Please go. Let me go back 1 second to just this. Parents and grandparents, please tell your kids we got to get your kids vaccinated. Help us get them vaccinated. It'll be really, really, really important. You know, we don't want to be late. We don't want to be sorry. Let's get it done. Thank y'all again.